Thank you all for being here. My name is Elizabeth Aloni, and I'm with Schneps Media. Schneps Media is the largest media company in New York City. We have over 70 newspapers, magazines, websites, webinars, podcasts, and events throughout Queens, Brooklyn, Manhattan, the Bronx, Westchester, Long Island, and Philadelphia. We are absolutely thrilled to be here with a group of professionals from Kingsborough Community College and be able to discuss how to prepare for a career in healthcare, something that's top of mind for many individuals, especially now. And Kingsborough Community College provides valuable classes to be able to get you where you want to go. So before we get started, I would like to introduce custom computer specialist with Tom Franson, and he's going to say a couple words and let you know about his organization. Tom, please.
Great, thanks, Elizabeth. So my name is Tom Franson. I serve as Vice President of Support Services for Custom Computer Specialists. We are known in the industry as Custom, and we're a technology company that has supported primarily education and healthcare for the last 41 years. So education and healthcare, which is why we're excited to be a sponsor of this discussion tonight. I would like to point out or mention that recently we helped CUNY Central by distributing over 32,000 iPads and Chromebooks to CUNY students at the beginning of the COVID outbreak earlier this year. And as colleges and universities prepare to reopen their doors, we continue to provide support and welcome these opportunities to give back to the communities that we serve. So I'd like to thank Elizabeth and Kingsborough for letting us sponsor this great event tonight, and thanks for including us.
Thank you so much, Tom. So I want to get started here. We're certainly honored to have this group of individuals from Kingsborough, and I want them each to have an opportunity to introduce themselves to you so that we can learn the best way to prepare for a career in healthcare. So first of all, I would like to introduce Simone Rodriguez. If you could please introduce yourself and tell us a little bit about what you do.
Sure. Good evening. My name is Dr. Simone Rodriguez, Vice President for Workforce Development and Continuing Education. On behalf of President Claudia Schrader and Kingsborough Community College, we thank you for joining us during this panel discussion. A little bit about me. I have more than 20 years experience in working with youth and adults in higher education, focusing on pre-college, workforce development, adult and continuing education. I am Brooklyn born and raised and proud to serve our community in preparing and recruiting the best of Brooklyn.
Wonderful. Thank you so much, Simone. Next, I want to move over to Micah Griffin, Director of Health Programs. Would you please introduce yourself and let us know a little bit about you?
Definitely. Thank you, Elizabeth, and thank you to just hosting this important conversation tonight. We're looking forward to it. As you said, I'm Dr. Micah Griffin, the Director of Health Programs at Kingsborough Community College. And in my role, I essentially support what we're going to be talking about tonight, all of our allied health programs, as well as some of our programs that aren't in our allied health department. But I support all of those programs from accreditation management to developing community partnerships with some of our hospital and community health centers across New York. So I'm just excited to be here, especially to have this conversation at a time like this where we know how COVID-19 has impacted not just New Yorkers, but Americans across the country and the role that our frontline workers play, especially our healthcare professionals. So I'm looking forward to kind of diving into this and seeing how we can, further expand our health programs across New York.
Thank you so much. Next up, Alexis Greene, Assistant Director of Continuing Education Programs. Please introduce yourself. Hello.
Hi, everybody. My name is Alexis Greene. I am the Assistant Director for Continuing Education Programs, namely our Healthcare Institute. So we basically are providing certification trainings for any individuals who are wanting to break into the allied healthcare industry. In terms of my background, I have a background in community and public health. I'm currently working at Kingsborough, but yet I am also an adjunct lecturer at Brooklyn College. So we are teaching out of the Health and Nutrition Sciences department there. But when at Kingsborough, we definitely are working with all of our allied healthcare professional students to get through their training programs and ultimately into their clinical experiences and into the job market. Thanks so much for having me.
Thank you. Wonderful to have you here. And last but certainly not least, we have Lisa, who is the admissions advisor. Please tell us a little about yourself.
Hi, thank you for having me. My name is Lisa Klugewicz. I work in the admissions department at Kingsborough Community College. So I am here to give you information how to transition as a continuing ed student into the associate degree program at Kingsborough. So I can answer any questions that you might have about how to apply and how things have changed at Kingsborough during COVID-19, and to describe some of our allied healthcare majors. I just want to say that I am Brooklyn born and raised. My mom was a student at Kingsborough, and I started out at continuing education as a little girl. So I'm really familiar with Kingsborough, and I love to be part of this family. So yeah, thanks for having me.
Wonderful. That's what a wonderful part of the story, for sure. Well, as you can see, we've brought together tremendous professionals here. And, you know, one of the things that certainly makes Kingsborough Community College unique is their unique ability to prepare individuals who want a career in healthcare. Obviously, Kingsborough has been facing the same challenges that other universities and community colleges have faced through COVID, and are doing all that they can to stay in line with what is the law in regard to safety, and also keeping their students and their faculty safe through virtual. Some things are virtual, some are online, so that certainly does vary. But Kingsborough Community College is certainly at the forefront of, you know, making sure that they're doing everything to keep their faculty and their students safe. So if you have more questions about that, we can certainly address that in the future, but that is certainly a priority for Kingsborough Community College. So let me ask Simone, what is the role of the Division of Workforce Development and Continuing Education?
Sure. So one of the main goals for the Division of Workforce Development and Continuing Education at Kingsborough is to provide accessible and affordable courses and certificate programs to fit the needs of our students, right? So while COVID-19 might have slowed us down a bit, but our team took the opportunity to really redesign our programs to ensure that our students will have an education experience to help them pursue their career goals. We serve close to 8,000 students within our division, where students are able to enroll in our flexible scheduled courses, small class sizes, and affordable tuition. During this upcoming semester, we will offer over 100 online and hybrid courses in a number of areas, such as business, technology, paralegal. Also, we have a test preparation program for high school equivalency examination. And English as a second language and CLIP program to help students learn and become more proficient in speaking, reading, and writing English. And if you're an employer or community board organization and need professional development for your members and employees, our workforce development team can design a program specific to your area and industry. In addition to that, we offer a number of programs in either Taxi Institute. We have a unique program as designed for 50+ years of age wellness program, and so many, many more of those programs here at Kingsborough. But one of the highlighted programs in our Highlight Health Institute, which has exceptional offerings, instructors, and employer partners, like certified nursing assistants and emergency medical technician. But I know I'll leave it to my colleague, Alexis Greene, who will shortly provide more details about those programs for us.
That's incredible. It seems like there's nothing you don't do or have, whether it's for an age group or a particular career choice, or, you know, based on your different experience, you know, pre-college, you know, and getting to college, it really seems like you're the bridge in all those different areas to be able to help people reach their goals and their dreams.
Absolutely, and we welcome and we are trained to do this well, and we are prepared to definitely work with all of our students.
And I could tell the, you know, the heart in it. It
Yes.
comes across for sure, and I think that, you know, is an important thing for sure.
Yeah, absolutely.
Alexis, you know, obviously healthcare has really moved to the forefront, you know, with, as you know, we're saluting our heroes, everything that's gone on through COVID. And so many people have really been inspired to join the forces of frontline workers who are doing such incredible things, and they're such brave and valuable individuals. You know, what can you tell us about the Healthcare Institute at Kingsborough Community College that are turning out more and more heroes every day?
So, Healthcare Institute, I can chime off some of them, but I'll give you a few. Our very popular programs include our Certified Nurse Aide, or what we call our CNA Intensive. Those students are going to basically leave us and go directly into the nursing homes where they're doing, you know, bedside care, things such as range of motion activities, assisting patients with feeding, getting out of the bed, any of those what we call ADLs, right? Assisted daily living activities are the things that the Healthcare Institute are definitely at the front line with giving students. Other programs include phlebotomy, EKG tech, medical billing and coding, electronic health records. We have a great pharmacy technician program, as well as electronic health records specialist. So at the end of the day, you know, we have a myriad of things that meet people's interests, but certainly are giving, I should say, students the skills and the competencies to work in hospitals, doctor offices, which is really, really vital and important considering, right, our pandemic that we're experiencing currently.
Absolutely. And it's interesting too that you have so many different medical focus, whether it's where you want to be with the patient directly, or you're more of a numbers person who really wants to work behind the scenes. There's training for those individuals who really want to get into this incredibly important field, no matter what that area is within the medical field. So that's really important for everyone to know too. It's not just
Absolutely.
one area. Yeah.
Another benefit of our program is that once our students are completing their courses, we basically are an NHA approved site. So the National Health Career Association is the accrediting body that we are working with to certify our students. So it's great to get a training program, right, and learn how to take vital signs, temperature, blood pressure, height, weight. But it's really important that students are also preparing themselves such that they can take these certification examinations, right, and show their proficiency and competency, and yeah, that they literally can do so whether it's in New York or in another state. So that's the cool thing about continuing ed in the Healthcare Institute, that we definitely couple our training programs with the certification opportunity at the end.
So for those people who don't know, what is the benefit of that?
Well, in short, employers, like I said, it's great to do a training program, right? But employers are definitely looking for people who are certified, have taken this national credential, right? Because it says that you meet national standards. So the biggest benefit to the student is that they're more likely to get job opportunities. But even if they want to work outside of New York, right, and life happens and they end up running away from COVID into another state, they definitely have that ability to, you know, leave New York and go elsewhere.
So it's not only that they are being educated, but then they're certified so that everybody knows it. And it's not just about bringing your diploma. It's saying that in those specific skills that are required for that position, they're being certified by the organization as well. And
ultimately, higher wages. You know, we know for a fact that if you're certified, you certainly would be paid more than someone who's only completed a training program.
Well, right there, that's a huge, huge benefit to be able to do that. And when you graduate, wonderful. This question is both Simone and Alexis. Kingsborough Community College has employer partners. Mm-hmm. Can you tell us a little bit about what that means and how that benefits students?
Sure. So we have employee partners in all areas, connecting our curriculum to the actual industry partners. So for example, we work with Maimonides Hospital for our community health workers, Menorah Center for Rehab and Nursing Care to train our certified nursing assistants. We have a really great user experience through our CUNY TechWorks program with our partners at W.W. Norton, Amazon, and Chase. We have a new partner in YI, Seeing Beyond Disability, for the direct support professionals. our Brooklyn Chamber of Commerce, that team, and Marine Maritime Trade Unions for welding. And so the list just continues, and it goes on and on as it relates to how important it is to work with our partners. And we're looking for more of those, right? So because then the more that they're willing to work with us, then they'll be able to get the best and most trained students and employees in the workforce. So we're looking forward to working with more. And if they do, they'll definitely be able to have the best. So this is just definitely a plug to get as many of them in to work with us as possible.
So these employers are saying that they're coming to you because they know the type of training you provide individuals, and that they know that they'll be very happy with the level of training that these individuals have. So I could see why they would want to partner with Kingsborough Community College. How does that benefit a student? I mean, is there anything that happens with students and placement in these companies? Is there, how does a student benefit from that?
Sure.
I think the biggest benefit for students is that, yes, they're working in the front lines, but they have one foot in the door, right? So we have the connection through Kingsborough Community College that we have an affiliation with these facilities. But the moment that they step foot into the facilities, right, they're working alongside actual employees, so it's a great opportunity for them to learn the culture of an organization, certainly work on their bedside care skills. But ultimately, by the time that they finish, they have enough orientation with that place. Hopefully it's prime to pump, that they may even want to look for employment at that location. A lot of our students come full circle with starting with our programs, going over to their clinical sites to do, the supervised training. And in most cases, the employers are very, very happy to offer employment to the students once they finish.
So what a powerful step in the foot in the door. They say it's not only what you know, but who you know. And the fact that you can already have this connection with, an employer, it puts you really above other applicants that they don't know who they are. They don't know their work ethic. They don't know the type of individual they are. So that's a tremendous benefit.
Absolutely.
Yeah. Micah, Dr. Griffin, you are the Director of Healthcare Programs. Can you tell me about the Department of Allied Health, Mental Health, and Human Services at Kingsborough Community College? It's a lot. It's a lot.
There's a lot to say, right? You had to slow down when you said they had to say it real quick.
Absolutely.
Yeah, 3 times fast, right? But no, I think the title actually speaks to, exactly what we're talking about, what Alexis just hit on with how the healthcare organization is set up and how healthcare in the United States is delivered. These different healthcare providers don't work in silos. It's all integrated, and we expect collaboration amongst our paramedics and EMS and our nurses and our sleep technologists and our physical therapy assistants. And as we're learning with COVID-19, the healthcare system isn't in a silo, and all these different health professionals have worked together to address different determinants of COVID-19 and how it's impacted our society, even from a mental health standpoint. We're seeing some of the disproportionate impacts of COVID-19. So having that mental health component of academics tie right into our department with those other programs makes it very sync and allows students that come into this department, into these programs, to be exposed early to other health professionals. So that way, when they do get out into the field, when they go to some of these clinical sites that Alexis just spoke of, they're familiar with what other healthcare professionals do. Not making them an expert in every field, but at least having some familiarity with what other healthcare professionals do and being able to speak that language. So if you do have a patient that comes in that's dealing with, COVID-19, you're able to have those conversations with any health professional, regardless of the type of field or background that they work in. And I think that was the premise and the idea behind why Kingsborough decided to develop this department. And it's a brand new department. We're not even a year old. So I think it was very timely how this department came together, a year before, this pandemic outbreak, and how we're starting to see, the role that these different healthcare professionals play in delivering services across the city and the country. But this is a new department, and we brought together 7 to 8 different healthcare professionals. And Lisa will hit on those a little bit when she talks about some of the admissions requirements. But we're an integrated department. And the reason the name is so long is because we have several different healthcare programs all tied into that department, from physical therapy assistant, paramedic EMS. We have a sleep technology program, the mental health component that prepares our students to pursue higher degrees or higher education in counseling or in social work. So the idea is that we're creating a holistic department. So it's not just addressing illness, but we're trying to prepare our students to recognize health behaviors and how we can be more preventative and look at healthcare from a holistic standpoint, especially from a health equitable standpoint. So I think that's the real idea behind why we developed this department, and then just to kind of hit on why this department is integrated the way it is and how we're providing, like I said, a holistic approach to our students that decide to pursue one of these degree programs in our department.
Wow, it's critically important because it really does take a community and it takes a village, as they say, to be able to help a patient and being able to understand all these different components. So a student is then, when they're in your department, what is it that's different that they might encounter in your department?
Well, the first thing I think is just the exposure to other health professionals. We're at Kingsborough, I can honestly say we're one of the only colleges in the entire CUNY system that has this wide array of health programs all under one department. And I think as we look at the direction that healthcare is going in this country, we're going to start to see a lot more health programs in academic settings, whether it's on the associate's level or the bachelor's level, really start to look at how your health programs are delivered and what you're providing to students. Because like I said, when a nurse graduates from our program, for example, we don't want that individual to just be familiar with nursing and the ideology of how nursing is delivered. You want that nurse to understand social determinants of health. How did a person become sick? How does the environment impact your health behaviors? How does where you ultimately live and the zip code that you live in impact how long you're going to live? And all these different things is what our students are exposed to, whether they're a nurse, whether they're riding on the back of an ambulance. They're going to come in contact with somebody that might be dealing with one in particular illness. But like I said, understanding how those social determinants of health got that person to where they're at makes this healthcare provider, you know, a lot more competent, a lot more job ready, and a lot more knowledgeable to be able to work in different departments across the country and not just in New York.
Wow, that's a great way to prepare students for sure.
Definitely.
What are the emerging trends in the healthcare bridge program? And can you tell me a little bit about that?
Yeah, definitely. I'm glad you asked that. And it actually ties together Simone's area, Alexis' area, and my area, which is on the associate's degree earning side. Because what we're trying to do is not only to give our students job-ready skills that they can earn in a certificate program, but also expose them to some of those what we call higher level or those degree earning programs. So for example, a student might come in and just want to be essentially an EMS worker, which is great. But we also have a paramedic program, which is a higher level first responder that allows them to come in as an EMS professional. But this bridge program is essentially a bridge. It ties together our non-degree earning side to our degree earning side and makes that transition a whole lot more simpler. So it's not as convoluted and as challenging as some of our higher educational landscapes can be. So essentially what we're trying to do is create a program or a bridge that allows that student to be able to come in on the credit earning side, gain a certificate, go right to work, but still be able to pursue a degree to advance their career or advance their standing. And the good thing about this bridge program, we've been doing it the same, probably not even a year now, but it's essentially a certificate program. So a student comes in and they take a free 1 credit course, yes, free. So you just have to sign up, be committed, commit to the program, and you get a free 1 credit. And the good thing about that 1 credit is that you can transfer that credit to a degree earning program. So if you're a student who comes in and says, hey, you know, I worked in this particular field and I want to try something else, you can come in on our certificate side and explore different offerings that we have. And then do this bridge program, you're connected with myself as the instructor. We also have advisors, career coaches that can help guide you and help you make a better decision or a more informed decision about what type of healthcare program you want to pursue. And they support you all the way through your certificate, all the way into your degree earning side to make that program and to make that transition a whole lot more simpler. And we are accepting applications right now. I have to put that plug in there. So anybody that's interested in either changing careers, exploring a career in healthcare, and there's no obligation. So if you're somebody who just says, hey, I just want to find out a little bit more about what Kingsborough offers, what this whole healthcare field is about, you can take this free 1 credit course, and it's offered online. So we made it very available, and you can take it, explore different health careers, and then decide, hey, I don't want to pursue healthcare anymore, which you probably won't because I'm a pretty great instructor and I'm good at convincing people. So once you get into this program, you're almost guaranteed to want to pursue a healthcare career at Kingsborough. But like I said, we are accepting enrollees now, and I believe our contact information will be provided after this, or there's probably a way, or I know there's a way you can get in contact with us So if you're interested in that program or want to learn more, definitely contact myself or Alexis, or really anybody on this call, and we'll be able to help you with that.
We are certainly going to provide the phone number, which I'll give actually the number right now I'm going to give is 718, and I will put it in the chat as well, so don't worry if you miss it. But it's 718-368-5050, or you can email at CONTED, which is short for continuing ed, right? CONTED at kbcc.cuny.edu. And I'll put that in the chat as well, so you'll have it, and you'll get an email after this as well with it too. But Micah, you definitely did a great plug, and that is really important to say. But so I just want to confirm. So our attendees today can sign up and apply to take this 1 credit class where they can get a feel for the variety of healthcare career options and programs they can take at Kingsborough?
Yeah, exactly. That's exactly what we designed for, is to, like, no obligation. You come, you have conversations with our faculty, so you're getting exposed to them. You can ask real world questions. You can explore and have a professional health coach, not a health coach, a career coach that can help guide you, help you with your resume, help you with interviewing skills. Essentially what we're trying to do, I think Simone hit on earlier, is Kingsborough, we're trying to be known as the healthcare providers, not just within the CUNY system, but within New York. And then we can prepare as many students as early as possible to understand how all of the healthcare careers are connected and to find something that suits their personality, their career goals, and their personal interests. And we can ensure that the healthcare workforce in New York is sustainable and is able to respond to get us over this COVID-19 pandemic, but also to build a stronger healthcare infrastructure within the city. So we're really trying to be at the forefront of that and just really prepare future healthcare professionals. So free 1 credit course, you can take it online. It's 6 weeks, it's live sessions along with recorded sessions. And once that 6-week session is over, you get a certificate of completion, and you can apply that 1 credit to a degree program in Kingsborough. So it's a win-win.
That's fantastic. Fantastic. Thank you. So obviously there's a plethora, we've heard from Simone and Alexis and Micah, it's a plethora of opportunity at Kingsborough Community College to get into the healthcare field and beyond. But now I want to turn to Lisa and find out, first of all, what are the allied health majors that you offer?
Well, I think that Micah did touch on a few of them. He mentioned and went into some detail. But before I tell you, I want to give you the benefit of choosing an allied health field. And the main benefit is that you graduate with an associate degree and you can go right into the workforce. So many of our allied health majors only require an associate's degree. So you would go to school, earn your associate's degree, and be able to go right into the workforce, which is really important at this time, especially. To name the allied health fields, we have the EMT program and paramedic program, which definitely has the bridge program from the EMT on the continuing ed side. And then coming to Kingsborough, you would have some credits coming in as an EMT, and you can apply that toward your degree. We have chemical dependency counseling, mental health and human services, physical therapy assistant, polysomnographic technology, which is sleep technology, which we are the only CUNY school in the tri-state area that has that program. And I want to say that it's 100% job placement when you graduate from Kingsborough from this program with a really good salary. Only requires associate degree.
Wait, say that again. Say that again. You have a program, the only program in the tri-state area, and there's a what percent job placement?
100%. We have actually hospitals and sleep clinics calling for our students that are graduates because you must be certified in sleep technology. And we are lucky to be one of the only schools that offer that program.
Wow.
And we also have surgical technology, which is another segue into the medical field, a surgical nurse, and alcoholism and substance abuse counseling certificate program. So that's it in a nutshell for us, but it's quite a few.
Yeah, incredible. And you could see certainly when what Dr. Griffin was talking about with how full range those classes are, those majors are, to be able
Yeah, and I want to say that being in admissions, I've come across many students that have participated and got certificates from continuing education, working in the health field, nursing homes. So many of our certificate programs that after they've worked in those fields, they want to come back and get an education, and they want to get their associate's degree because they've got their feet wet and they've been so much more exposed to the healthcare field that it inspires them to want to go back to school to further their education. And that to me is really inspiring. And I see the students really succeed and have such support at Kingsborough. So.
Fantastic. So how does, I'm sold. So how does one apply, and how has that, and then let us know a little bit how that has changed. Has COVID, I think, some people are concerned about applying to schools and are things backed up? So if you could walk us through that, that would be great.
Sure. Well, because of COVID, we do not have in-person application process anymore where you could just walk in and apply. So everything is online. So if a student wanted to apply to Kingsborough, they'd have to go to the CUNY website, cuny.edu, and fill out an undergraduate application. If they were a transfer student, if they attended a certificate program, they would want to apply as a transfer student. So everything is done on the CUNY website. And then submitting documents would have to come to Kingsborough if you were applying for the fall. But if you are applying for thinking about possibly down the line for the spring semester, you have more time, but time is of the essence for the fall semester. It's, quickly approaching the deadline.
So when do they begin?
September 12th is the official first day of school for the fall. Okay. So we do rolling admissions, so students can apply up until very close to the first day of school. So there is still time. So if you are interested, please let us know, and I can help you. We can help you in admissions with the process, and we'll post that information as well, the phone number and email address.
Okay, so I did put in, just so everybody knows, I did put in the chat the phone number, the email address, as well as the cuny.edu website. So all of our attendees can go and get that information now and take that, but we will also send an email to all of our attendees with this information as well, and jump on it, because now's the time. I mean, there's no accidents. You're here for a reason. They're extraordinary programs, and this is really perfect timing to get started.
Definitely.
Wonderful. So I wanted to just, in wrapping up, I wanted to stop with each of you, and I'm going to start with Simone. But we're so lucky to have this panel of experts here today, and I'd like each one of you to provide one inside tip on preparing for a career in healthcare. Maybe this is advice that you'd give your family member or your child or your best friend. Since we have you, we'd love for you to be able to share with us something special that we should need to know, that you would want us to know. So Simone, would you share first?
Sure. I mean, it's so hard to just give one advice, right? But what I would definitely tell family members is that if they have a passion in working in healthcare and in any capacity for any of the majors, either on the continuing education side or the associate degree, definitely, and you want to be trained, you want to be prepared, you should start at Kingsborough. I've been here for over a year, and I see the value. I see how our instructors and our staff are definitely preparing each and every day to welcome everyone into this field. And so definitely join us at Kingsborough. That'll be the first start.
Wonderful. Thank you so much. Alexis, what is your tip?
So if I were talking to a family or a friend, I definitely would say yes. Start with continuing education, choose Kingsborough, come on over to the CUNY family. But then I would also say, figure out what populations, if you're wanting to work in healthcare, figure out those populations that you really enjoy working with. When I first got started, oddly enough, I offered or actually did a mammography program in Harlem. And it was the craziest thing at the time to be fresh out of college, in my late, mid-20s, and I'm in Harlem, basically getting everyone uninsured or underinsured onto this mobile mammography unit. And people are like, Alexis, thank you, right, for making us come and get these mammograms, and thank you for, you know, telling us how important breast health is and that we should definitely do our early detection for breast cancer. But, you know, you're only 20 something. You're not even of age to get a mammogram yet. But I say all of that to say this: I enjoyed the population of patients who were 40 and older, because a lot of them reminded me of the women in my family, my aunts, my beloved grandmother. So yeah, that's really important. If you're working in healthcare, you want to figure out, you know, not only that discipline, you know, that you're going to excel and do well in, contributing your time, but also the population of people who you are really connected with through your own personal experiences, but who you truly have an interest in caring for.
That's great. That's really great advice. Thank you. Doctor.
Oh, that was
What's your
that was really good, Alexis. I kind of felt like that was very sentimental. I like how you tied in the personal touch.
It was, and I have to tell you, people over 40 were very nice.
Okay, that's good to know. I got a couple years to keep that in mind.
They're very nice.
So you clamp your breast down between panels, like, you know, that could be a different reaction from the 40 and up crew.
I'm sure. Well, they were happy to see you at least.
Right. But no, I would definitely say, if I was advising someone or talking to a family member, I would say do something. Like, make that first step, because healthcare before in this country was a booming field, but I think now with what, you know, this pandemic has shown us is that the healthcare field is only going to grow. And it's only going to grow in a better direction to be more supportive of people, of communities, really focusing on how health is generated and what impacts our health. There are all different avenues that you can take. I know a lot of times high school students or people that aren't in the healthcare field, they hear healthcare, allied health, and the first thing that comes to mind is doctor or nurse. They think that's all you can do in healthcare and that's all I can be. There are hundreds of professions and hundreds of different fields within healthcare. My background is in community health, and I ended up being a director of a student health center on a college campus. And I would have never known that, you know, a healthcare administrator at a college health center was even a thing when I was exploring healthcare fields. So I would just say be open, but just start exploring, like really start exploring and do something. Like, contact one of us, fill out an interest form on a website, call a doctor's office, call a hospital. It might be a little more difficult now to go in and shadow, but you can just start reaching out to some of these professionals. I love talking to undergraduate students that are pursuing health careers, or master's level students in public health programs. Like, I love mentoring and having conversations. So I would just encourage people that are interested in this, just reach out to people, contact doctors, nurses, whatever field you might be interested in, and just say, hey, can you tell me a little bit about, you know, what your day is like? Contact them on LinkedIn, but just make the first step towards the healthcare field, whether it's contacting someone, whether it's doing a Google search, whether it's taking our 1 credit Bridges to Healthcare program, which starts in September and is free and is offered online. See, I'm trying to plug that again right there. That's what I was slipping that in right there. But I would just say do something, because the healthcare field is not shrinking. This is one of the fastest growing sectors in the country. And like I said, we at Kingsborough are here to support you, not just as people on this call, but all of our amazing faculty as well. So just reach out to us and make a step in that direction to do something like today, not tomorrow, like today. Like, make that decision and we'll be here to support you.
That's really great advice. And, you know, already our attendees today are taking their first step, just being here and hearing this. And you're right, they could make the next step today, because things are online. Like you said, I mean, you can go online, you could sign up for something tonight. It doesn't have to be during business hours. So really, definitely great advice. And last but not least, I would love to hear from Lisa on your tidbit of advice.
Sure. Well, firstly, I definitely can say that COVID-19 has proven to be a challenge, but for us, I think the advantage we have now is that we're having classes all online. So it brings the element of flexibility. If you have a job, you can attend school online and create a schedule that works with your work schedule. So it's given the opportunity for more people to come to school and get an education. And I think that you should take advantage of that. If you thought about attending college, but you thought, maybe I have a job, I'm working in healthcare, or I'm exposed to healthcare, but I'm not sure. Now is a great time to get your feet wet and apply, take a few courses if you're not even sure if you want to be full-time, but just come, because the flexibility is there, and we have so many supportive services, internet, technology, students, if you don't have a laptop, we can lend them to you. And then who knows when the spring comes along. Kingsborough has the most flexible schedule. 7 days a week we have classes. We have classes from 8 in the morning till 9:45 p.m. in the evening. Saturdays and Sundays, if I just said that, I'm not sure, but it really gives you the opportunity to earn a degree, even if it's not full time. You know, you could do it. And that's like, even my daughter actually just applied for Kingsborough today. So yeah, I want everybody to come. And I think that you wouldn't be disappointed because we are such a wonderful family with so much support. So I feel like we're there for the students. And if you're not sure, you should try. Come, apply. Don't be afraid.
Well, you can certainly see the warmth out of our panelists and their passion for Kingsborough Community College. And that's a very unique thing. You know, you can't, you know, you can learn so much and you can provide so much, but also the caring behind it. I mean, that really, isn't that what the healthcare field is all about, is so important. Thank you. So
I wanted to say one thing, because I saw a student mention something about finances. One thing that is really wonderful about Kingsborough is that our tuition is very affordable. It's $2,626 a semester. I would say, like, a lot of students come with financial aid, but if you don't receive financial aid, our tuition makes it affordable, more affordable than some of the other colleges, and that's a positive.
Wow, that's great to know. I mean, the sleep program, 100% a job, and affordable way to be able to learn. It's really important, you know, because education can be very expensive, but it certainly is worth it. So to know that it's affordable and that if you don't have financial aid, that shouldn't be a stopping point. You should still take steps toward it. Very important. So we do have some questions from attendees here that I would love to ask. So we have this question, actually this came up a couple of times. It's for someone who already has an associate's of an arts degree. Would the healthcare profession, you know, what would you recommend a healthcare profession for someone who has an arts degree? You know, is there something in particular that's, you know, maybe a little bit more artsy when it comes to healthcare? Does anything ring in your minds on that?
Is this an actual associate's in art? Like, did they say what the particular field was?
It says an associate's, and it's with an art degree.
Oh, I think they said it doesn't have to be artsy.
I think, is it liberal arts? Do you mean liberal arts?
Yeah, probably liberal arts.
Maybe they mean liberal arts instead of being a science associate. Thank you.
Right, it's probably not heavy science based. I'll just add something real quick, which is another plug to our Bridges program, which is great to explore different fields and be able to see what career aligns with what your passion or your interest might be. But just off the top, we do have a recreational therapy program, which is similar to physical therapy, but it uses modalities and it uses exercise and it uses physical activity for rehab. So if you get injured, whether you break your arm or pull a muscle or tear something, recreational therapy essentially uses a different type of approach to rehab, but it uses a very integrative approach. And it's not, even though this person said not really artsy, but that's something that's not very, I mean, there is science involved, but it's not as heavily science-based as like our nursing or EMT paramedic program. So recreational therapy is a good option, as well as community health or even mental health. Mental health is a good field because they use a lot of different therapies to treat patients.
I could add to that, as a transfer student, we do accept up to 30 credits. So if you have an associate degree in art and liberal arts, you can apply a lot of those credits towards your degree. So that would make your time at school less. You wouldn't be spending as much time. You do a transfer evaluation. So you might not have to take elective courses that you've already taken or English class. So you can focus more towards your major, and you wouldn't be in school for another 60 credits, depending on how the credits transfer. So you're on mute.
I see that. What about life experience? Is there any credit or testing that people can do, or it really has it needs to be a schooling?
I don't know how anybody else, we do not do the life credits. I believe that was something that was in the works. If somebody else wants to chime in with that, Simone?
Sure. CUNY just approved the policy to approve the credit for life experience. And so if students have had life experiences and not necessarily a degree, then they're able to go through the process of having them reviewed and then be awarded credits for it. So we just approved this policy CUNY-wide at the end of June. And so we are going through the process right now of implementing them at all of our campuses. So it's definitely a great time in terms of the question.
Wow, that's huge. Fantastic.
Yes.
Fantastic. Thank you for the question. There's someone here who, again, we're looking for, what's the right career for me, but a bachelor's degree in sociology and a minor in psychology. What healthcare career would you recommend? Currently, this person is Rosa. She is working as a childcare provider. Are there any programs that, you would recommend? Sounds to me, I think you have a lot of programs that would work very well with a sociology and psychology degree, right? I mean, Dr. Griffin, I think that's right up your alley.
Yeah, I would, sociology and psychology, they're human service driven fields. So I would definitely say maybe explore our mental health program. If you're interested in going into the clinical side of delivering care to improve people's mental health, but also even psychology. Even though you minored in psychology, you could even consider majoring in psychology with us on the associate's level and then still pursuing, a bachelor's or even a master's in psychology if you want to go the teaching route. You mentioned working as a child care provider. If you're interested in staying in that, they do have psychologists that work in child care and in child adolescence mental health therapy. So there's a lot of different areas, but not to stray too far from what you've already done and your area of expertise. I would definitely say consider either mental health or even psychology as a particular, or even social work. Social workers tend to work in all of those spaces together, improving outcomes for mostly underserved communities. But our school, I would say probably mental health or even psychology.
Great. And it makes me think of what Alexis said, who do you want to work with? What's the population that you want to work with in being able to help you come up with some, that was, really great advice.
Oh, even community health. I don't know how I forgot about that. Community health.
What is?
Community health. Is a similar field of public health, but community health looks at more of how the community actually impacts people's behaviors and health outcomes. So, how does living in a neighborhood where there's no access to a grocery store, how does that impact your eating behaviors? Or if I have to take 3 trains to get to my doctor's office, how is that going to prevent me from seeking medical care? So community health actually looks at how those determinants of health, which is similar to psychology, actually impacts people's lives and outcomes. So community health is another great field. And that's offered completely online right now. So that's one of our programs where you can take community health 100% online.
Human services also.
Yeah, human services too.
I mean, kind of given the climate, where people are out of work, they may be in need of housing and shelter and food, so being a point person, that connects, the public to, social services, human services came to mind also for Rosa.
Wonderful. Thank you so much. Mary Lou asks, and Lisa did answer, but I want everyone to be able to hear this because I'm sure other people have this question. Do you need to have an associate's degree to start, or can you just get a certificate and work your way up to a higher degree?
So in the continuing ed division, the general requirements for anyone who registers, I know that there was someone who threw into the comments, hey, what about high schoolers? So high schoolers can take continuing education courses so as long as they're at least 18. So at minimum, you have to be at least 18 with high school diploma or a high school equivalent. And for any of our ESL learners or people who speak another or their native language is other than English, we do recommend that you be at least what we call an ESL level 8 proficiency. So a lot of times people, who aren't native speakers of English, they'll come to us before taking any of our certificate programs, including healthcare. We'll have them assessed for their ESL proficiency. And then based on that, we actually have 8 or 9 different ESL levels. So ideally, we want you to have or test at a level 8 proficiency before you come into any of the certificate courses. But yeah, no, you don't have to have a degree, certainly a high school diploma or an equivalent to start out in the continuing ed division.
Wow, that's great to know. And someone also asked about the community health that Dr. Griffin did answer, that whether or not it was a degree program, and they do, Kingsborough Community College does offer an associate degree in community health. So one other question, we have a couple more minutes. Question that came in from Edward: is a master's in OT worth it given the debt versus salary? Going back and have to take many prerequisites and looking at Kingsborough. So a master's in OT.
I'm assuming he's talking about occupational therapy.
Yeah, I'm assuming too.
I mean, worth it, that's subjective.
Yeah.
It depends on what your goals are. I mean, if your goal is going into a career solely for the reward of the finances, the salary, which we know money is a motivating factor. But you got to really see what's going to give you the passion to drive you to do that work. And occupational therapists now are working in all kinds of settings. Initially, occupational therapy was just in a rehab outpatient setting, but now we're seeing occupational therapists in schools, on athletic teams, in hospitals, in the military. So it just really depends on the state, depends on the setting. But I would say, yes, any type of therapy program, whether it's physical therapy, occupational therapy, is always going to be worth it, because we always are going to have people that are being born, dying, and breaking stuff because we are clumsy. So yes, you never have to worry about any type of therapy program not ever being worth it. I would just say explore different settings, look at different states and different settings as far as where you can be an occupational therapist at.
I could add to that one also.
Yeah.
If you want to come for prerequisites at Kingsborough, you can apply as a non-degree student, and you pay $265 per credit. So it is also very affordable to take the courses at Kingsborough, the prereq courses, and then transfer out if that's your goal to do your master's. But you can apply as a non-degree, and we are accepting non-degree applications. So yeah.
I think the moral of the story is call and talk to somebody and find out, because there could be a million individual questions and individual life circumstances. But, you know, I think one thing that comes out clear from all of you tonight is, you know, how open you all are to be people reaching out and taking those first steps to be able to ask questions and find out what's really right for them. So, you know, I thank you all for being here. This has been really informative and valuable. And I know I learned a lot and really enjoyed it. And I'm sure all of our attendees did as well. I'm seeing lots of thank you. This was great on the board. As I promised, I will be sharing all of that contact information. You will be getting it. Please look for an email that you'll get in 24 hours that will have that information there, and we'll give all of that to you. In the meantime, you can just go to cuny.edu quickly if you need to get there before 24 hours, because as Dr. Griffin said, take the next step immediately, even tonight, so you can start poking around. You'll get your email tomorrow. We also did record this webinar, so it will be available within 24 hours on the Schneps Media YouTube channel. And there'll be a reminder about that in the email as well. So I want to say thank you so much, Micah, Alexis, Simone, Lisa. This has been a wonderful time this evening to spend with you. I appreciate your generosity of spirit and information. I hope so many people reach out to you, and thank you for encouraging all of us to go for our dreams.
Thank you so much, Elizabeth, for hosting us. Thank you.
My pleasure. And also one more thank you to our sponsor, Custom Computer Specialists. Thank you for sponsoring so that we could be here and provide such wonderful information. I want to wish you all a very wonderful evening. Please check out our website, schnepsmedia.com/webinars for our future upcoming webinars. We try and keep you in the know across so many different categories. So we hope to see you again soon. Please, everyone, stay healthy, stay safe, and take that step.
Yes.
Have a great night, everybody.
Have a great night. Thank you. Bye.
Bye-bye.